Good afternoon. Welcome to our live webinar, Post-COVID Urban Mobility in Low-Income Countries. I'm Wei Yang, Vice President of the RTPI. It is my honor to welcome you and all the speakers in this important session, focusing on an international agenda. The COVID-19 pandemic has changed the world we live in many ways. Now, there's a strong desire from the public to have a green recovery after the pandemic. In a recent international survey, 65% of the 28,000 adults interviewed suggested that climate change should be prioritized in the economic recovery. Across the 14 countries took part in the survey, the highest percentage of supports were from India, Mexico, and China, with at least 80% of the people interviewed were supportive of a green recovery. This is exactly why we need closer global collaborations and partnerships. Today, the RTPI launched a new campaign, Plan the World We Need. We all live in one world. To achieve the Sustainable Development Goals, to tackle climate and the biodiversity emergency, we need to think globally, act locally, and to be equipped with the state-of-the-art knowledge and technology. Currently, as part of the delivery of the RTPI newly launched 10-year corporate strategy, an international strategy is being developed in a process led by RTPI members. It is the time for us to take the lead, to set a new professional standard for planning to be a global force for good. During this whole week, our Planner Live online conference will address how planning can support the recovery and help build a future which is inclusive, resilient, healthy, and sustainable. Without further ado, may I introduce the chair of the session, Dr. Michele Vianello, the RTPI International Policy and Research Officer, to introduce our distinguished speakers and start the session. Again, thank you for being here today, and I hope you will have a productive and interesting session. Thank you.
Many thanks to our President Wei Yang for introducing this very interesting session with our experts. We are indeed at a critical juncture with 10 years left to achieve the SDGs globally and the need to raise our ambitions for the Paris Agreement. And this is why the UN has called for a decade of action to urgently accelerate global efforts. Most of us are familiar with the overwhelming pace of projected urbanization in the coming decades. And according to some estimates, this will mean building a city, the equivalent of a city for 1 million people every week until 2035. UN Habitat has recently estimated that 65% of the targets underlying the 17 Sustainable Development Goals are linked to territorial and urban development. And how new city dwellers will access jobs, education opportunities, leisure, and more will be a make or break issue in achieving the global vision of SDG 11. So the positive effects of planning for sustainable urbanization go actually beyond cutting existing emissions and preventing new ones, but include foster real inclusive prosperity and realizing urban economies of agglomeration, increasing the supply of affordable and dignified housing in connected places, and so on, particularly, of course, in low-income countries. During the pandemic, active travel is a lifeline to many, making access to income possible as well as running essential services in cities. And this crisis has shown a new light on this, with renewed media attention on active travel in low-income countries, even from unusual outlets like Wired or the Financial Times. So we need to make sure that appropriate investments in mobility are made and taking stock of the coping strategies and new insights from cities and communities that are coping with COVID-19 in low-income countries. So this is why we're very glad to host today a discussion on the DFiD-funded High Volume Transport Applied Research Program and how this is responding to the challenges posed by the pandemic and how it's addressing the recovery in low-income countries. Please meet our panel of speakers today on the screen, which is composed by Bernard Obika. Bernard is team leader at the International Development Consultancy IMC Worldwide. IMC is currently delivering this DFiD-funded program, and Bernard will introduce us to how the program is working to address COVID-19 and recovery. And after Bernard, we will hear from Holger Dalkmann, which is momentarily not on the screen and will join us again soon. Holger is CEO and founder of Sustain 2030. He will provide an overview of key urbanization trends and the changes required in the transport sector to address the issues I have outlined before. Finally, Jim Walker. Hello, Jim. Director at Walk21 Foundation. Jim will discuss how low-income countries have been catalyzed by the COVID-19 crisis to start to shift thinking more about the benefits of walking and cycling. And they will discuss major challenges to this shift and how it could present opportunities for mutual learning across the global north and south. Without further ado, I'm glad to leave the floor to you, Bernard. You should be able to share your screen now. Please remember to unmute your microphone. Apologies.
Yes, thank you very much, Michele. Can you see my screen? Can you see my screen?
Yes.
Okay. Thank you very much. Really my proposal is to introduce you to the High Volume Applied Research Program, which, as Michele has said, is housed within the IMC worldwide. So the High Volume Transport Program is an applied research program which is funded by the UK aid through Department for International Development, DFiD. The purpose of the program is really to strengthen the evidence base that will support increased access to transport, more affordable trade routes, and safer, low-carbon transport in low-income countries. So we are doing this to, as you will hear later from Holger, there's up to 2 to 5% of the cost of GDP through traffic congestion. We've all heard about the transport is responsible for approximately 25% of the greenhouse gas emissions that contribute to climate change. Traffic fatalities account for 1.3 million deaths per year, and a significant majority of those, as you will hear from Holger, are in low-income countries. And about 16,000 people die weekly from pollution. So the high-volume transport is really in existence to address these issues in the context of low-income countries. So we're doing this through, first of all, ensuring that whatever we do has a research uptake and capacity building. Capacity is a big issue in many low-income countries. We're working across fragile and conflict-affected states. Inclusion, gender, and road safety is a key area of focus for us in many low-income countries. The 1 billion odd people with disabilities have very limited opportunities to get to work and to make their daily livings. Many women and children still suffer from mobility facilities. We're doing this through reforming policy and regulation. So we do carrying out research on policy and regulation, direct intervention on climate change mitigation issues such as energy options, and of course, also addressing the related technology issues. I'd just like to focus perhaps more specifically on what we've been doing in the recent months in response to the COVID-19 crisis. We've been looking at the transport system as the conduit for infectious diseases. So we've been carrying out research, some in collaboration with a number of organizations, on how we can mitigate infection in the cities' transport systems in low-income countries. We've commissioned short-term research on the nexus between transport and health. We recently launched and are about to award about 20 small research projects on innovative ways of responding to the pandemic in low-income countries, including recovery and stimulus package research aspects. We're compiling a compendium of current practice to inform cities in low-income countries on the best or current practice as we know it. We've conducted a number of webinars, and as I'm sure many of you will have been attending many seminars, but we've focused specifically on working with parliamentarians across low-income countries to see as a way of focusing action with the decision makers. We are conducting about 11 major projects on various aspects of transport, and many of these we're pivoting to address the issues around COVID-19. But we're also working with the international community, the World Bank and others to try and have a collective response to the pandemic so that what we do is done much more effectively and it gets to the right people who need it most. I'd just like to conclude by expressing the common areas where I think transport, particularly high volume transport, can connect and work more with in a multidisciplinary manner. And there are common areas that sort of I see the need for much more integrated approach to planning in the context of transport. The concept of livable cities is one which planning is very closely related to the transport issues we'll deal with on a day-to-day basis. Transit-oriented developments is one area where there's need for much closer collaboration between the various disciplines. The concept of smart cities, as we've seen in recent weeks and months, how transport can impact on the space, and indeed the dynamics of those changes that we've seen under COVID-19 suggest we need to be working together to look at the connections between transport, space, and time. The future of transport is changing. We see pop-up cycle lanes. That means that, and the increased active transport and the way the public perceives public transportation systems and what that means in the future of demand for transport. There's much more need for closer integration in terms of what we do in our respective disciplines to answer those future trends. And of course, we need to be questioning together the very issue of concept of mobility. To what extent do we need mobility? Can we somehow influence the way the public behaves and understand the concept of mobility itself, the need for mobility in our lives? So thank you very much. I'd like to pass back to Michele, who will introduce the next speaker.
Thank you very much for that overview, Bernard. Very useful. I would just like to show on the screen for a moment the Twitter handles for some of the speakers and their names. If you want to engage with us online, here they are. But essentially, without putting any further ado, we can give the floor to Holger. Please be reminded that you are very welcome to ask questions, but they will only be answered at the end of the session, and there is a specific box in your dialog box on your screen. So we'll look forward to read those questions when you want to ask them. Please, Holger.
So good afternoon, everybody. First of all, it's a true pleasure for having the opportunity to speak today. I'm just trying still. Can you give me the opportunity to present my screen, please? Okay, can you see my screen now, everybody? I can't see you at the moment, so please just unmute so that I can.
Yes, we can see your screen.
Okay, wonderful. Thank you so much again. So again, thanks also for the opportunity to speak here, and building on what Bernard Obika shared on the high volume transport, I'd like to dive a little bit deeper on what the program has done, as well as focusing more so on the issue of, sorry, I'm still have some technical issues. Apologies also for that. So building on what Bernard Obika has shared us earlier, I'd like to dive deeper into, again, so this is, don't know why every time or so coming up or so the, not my presentation again, is apologies. So I hope we solve that also in a minute. Okay, so I'd like to focus on my presentation also on urban transport in low-income countries in times of the COVID pandemic. We heard also from Bernard the common challenges we have, particularly in Africa and Asia. And as you see also from these pictures, it's dominated by people also walking, as well as taking also informal transport system like minibuses and matatus and rickshaws. The challenges here we see also on the pictures are actually the congestion, and the loss here, according to World Bank, is up to 10% or so in African and Asian cities. But also, as we know, so the impacts through that, so particularly on air pollution, we have more than 2 million deaths annually in those continents, as well as a high share of the global road fatalities, with more than 600,000 annually. And as you see also here on the graph, particularly in North Africa as well as South Asia, so have the highest polluted cities around the world. So now is on top of this, we suddenly also have COVID. The world comes to standstill, and we have to look at what happened now and what are the impacts. First of all, globally, as well as in low-income countries, in total, so lockdown or so traffic massively reduced. And particularly as public transport is affected, as we know, so the challenges there in close areas, in also the high risk of being also close to each other, and you have seen also the situations, particularly so in global south cities. So, and here you see also on the graph, again, also a similar picture around the world when it comes also to the massive reduction of public transport almost all over the world. That comes also with a surplus. Here's the numbers recently also from India, where fatalities are also reduced also by 2/3. And we have seen also pictures on really also positive impacts, reducing also air pollution. And here you see on the graph also the numbers decreasing in India in NOx almost by 80%. So quite some also positive impacts also through the reduce of traffic on the environmental side. At the same time, we see a lot of social impacts, and here I would like to highlight also the issues around also gender and gender difference. A small study also from the Flown Initiative highlighting women in transportation, not just suffering also from the loss of jobs, but also have also the additional responsibility also often also on the presence of children at home, offers the question of food insecurity. So here there are differences also which we also have to look into, and also the high volume transport particularly look into also these differences and try also to contribute to overcome them. Talking about overcoming, we have seen, and Bernard talked about a massive increase in Europe as well as Latin America on cycling. And on the right, you see also the cycle planners of Bogota, where they also came up with 150 kilometers new cycle lanes. However, we've seen, unfortunately, so far, neither in Asia nor Africa, so a lot of those solutions so far. And you see here on the left, there's still discussion in cities also like Bangalore, where there might be also sooner the first pop-up bike lanes. However, it seems to take us far more time also in those countries, so the question of capacity as well as leadership. And leadership is crucial here, and some positive signals came, for example, out of Uganda. The president first time also highlighted in his speech the importance of cycling and walking, which usually also is not the mode or so often as leaders in many of the countries really also are supporting, and that already had helped us to increase the use of cycling as a zero exposure mode. The other challenge we have also is formal and informal public transport and the solutions here. So the sheer density of cities, there is good practice around also wearing masks. There is also, like we see on the picture here in Vietnam, the enabling also physical distances as well as also mask wearing. However, it is still a challenge. And the biggest challenge is, in fact, and you see here pictures from Lagos as a post before COVID. We have a visual cycle here. So currently we have far less customers, which also means there's a lower income for those drivers and operators, which immediately responded because they are not often as regulated through increased prices, which makes those workers and employees make it less affordable, and that also means there's less access also, and that means there's less income for population also who is highly dependent on informal and formal public transport. So here, one of the elements is where policymakers need to pay far more attention to. The other is the link between food security and transport. And according to WHO, about 73 million at the moment is in Africa are as a face food insecurity. We have seen good examples in terms of South Africa and Botswana and other countries also allowing small-scale food markets also to increase the accessibility. We have on the bottom side also the users of rickshaws in Bangladesh also providing also food supply, as well as the important message around also keeping also borders open to enable also still also the supply chain also for food. We are at Bernard's mention, so we have done some work also with the Climate Parliament, where we also created a policy note, and here is some of the key messages we found is particularly important in terms of policy and policy action. It is vital also on the public transport side and in the informal transport sectors to still also ensure also inclusive and fair services. Some countries starting also to provide also cash transfer directly also to some of the operators. Walking and cycling, and we will hear far more also from Jim about also that to really enhance and empower also cities also to take action, and in cities where already plans exist, like in Addis Ababa, is really also to build on that and start immediately also with the infrastructure. But finally, and finally also the issues of really financial packages, which are crucial also now, but is even more so through the recovery stage. What we should also discuss more is in fact taking us this time as an opportunity, the pandemic also, to really move towards also a low carbon and inclusive transformation. So we have not a strong, usually not a strong national mobility policy. So here is thinking about finance, the questions of planning is absolutely vital. There is a lack often of institutional capacity for better integrated transport planning, and here the opportunities to really retrofitting in the infrastructure for post-COVID use, and as Michele also, and as well as the Vice President of RTPI highlighted, so the opportunities for climate, and here particular with the climate change conference in Glasgow coming up in 2021 now, to come up also with a stronger national climate plan. Two final slides. We have done also a research on what international organizations can actually do and how they respond. And here's this table just show an example on specific policy note and guidance, and you find also under that link also more of those details. However, we see also that there is still too many voices providing us too much different types of information. So we're calling also for an action agenda, creating a common platform for collecting and disseminating information and research findings. So the good go-to place is crucial also to provide us international finances for transport to respond to COVID. And this is a moment also to improve also the education as well as capacity building agenda. And I think an organization like RTPI can also have a very good contribution also to that. With that, I also like to thank for your attention. You find us under this link much further information as well as also the reports I was referring to. And again, apologies also for the technical issues.
Many thanks for that, Holger. And indeed, at the end, there will be an opportunity to discuss a little bit what the RTPI is planning to do with its international strategy, but certainly collaborating across the built environment professions to focusing on outcomes is one of the key themes emerging, and it's necessary to achieve sustainable urbanization everywhere. I would now like to give the floor to Jim Walker for the final presentation. I will now make you presenter. Jim, you're ready. Please.
Great. It's just it's just loading up. I don't know if you can. Sorry, it started in the middle. Just give me a second. Sorry, I don't know why it started. Okay. Are you there? You're seeing the first slide, I hope. Thank you very much for inviting me to speak here. I wanted to share with you just a little bit more detail based on what Bernard and Holger have already mentioned about COVID and the responses that are happening in lower middle income countries, especially. People in the United Kingdom, where I know this is being hosted, will be familiar with this sorts of graphs and data that will see how park use has gone up. This is London data showing at least 50% increases, whereas retail trips have gone down. The first point I want to make is just how poor data is in many of the low-income countries. And much as we do have really good understanding, we're using here Google data very often and Apple data in order to get this understanding. And the reality is, in many countries, and this is data here from Africa, it's actually only a third of people in African countries have mobile users. And when you start looking at the quality of the data, you'll realize that actually the parks have gone down just as much as the other journeys. But generally speaking, the amount of mobility has not seen such a significant drop as we might have noticed in what we might call the global north. And certainly there's been an increase in more local neighborhood trips, which we've seen pretty much globally. But the changes are not so significant in mobility, and that's mainly because people still have to make their trips. Now, we've seen, when we think about the design, and there's been a lot of pictures, design guidance out that has been suggestion about how we should shape our streets, our public spaces to actually reflect what people need, this increase in capacity to really facilitate more walking and cycling as the safest solutions for mobility in response to the COVID crisis. These pictures you'll have seen have been copied in many countries, but the reality is that in many lower middle income countries, we've got at least 70% of people walking already, and the capacity was never sufficient when we started. And so it would be a luxury for us to think about using surveys like this, and I know many of you will be planners. Would be nice to know where we have sufficient space on streets in our existing networks. Here's pictures from New York and from Paris, where we could tell on both sides of the street really good quality data about where we could accommodate 1.5 meters, 2 meters, or more than 2 meters spacing. However, we know from data, and this is IRAP data, really good quality data about, they've looked at the mobility on more than 358,000 kilometers of roads across 54 countries. And the stark reality is that 85% don't have a footpath, 92% don't have crossings, and in fact 91% don't have any bicycle facilities either. And it won't be surprised to hear, but actually getting quality data like this gives you a thorough understanding about the fact that this crisis of COVID is not our only crisis that we're having to deal with. You saw the headline figures, but in reality, on a daily basis, we think that of about 2,500 people, 2,300 are dying from COVID on a daily basis. This is May data, so forgive me if it's a little bit out of date. As far as we can tell, about 6% of those deaths on a daily basis are in lower middle income countries at the moment. Now, obviously that's changing all the time, but it's very hard to know whether that's an accurate understanding or not. What we do know, because we've been studying it for a lot longer, is that there are 854 pedestrians dying every day, 112 cyclists, and 93% of those, best as we can get an understanding, is happening in lower middle income countries. And that inequality is exactly the crisis that we've been living with for a long, long time, and actually haven't really done enough to sort out. And these other crises that people talk about, physical inactivity, which is actually killing more people in the global north than it is in low-income countries, and air pollution, which again is largely in more developed places. It suggests that when you put these numbers together, and this is the point I really wanted to make, is that there's more than 8,000 people dying globally from these current pandemics on a daily basis. And COVID clearly is a massive, significant issue. But in low middle income countries, it's the crashes that are really killing people on an everyday basis. And because of the data that we've got at the moment, we don't really see how COVID is really having as big an impact as clearly crashes are. 59% of daily deaths are from crashes, about 12% from COVID. Now, I guess what I'm saying is that at least there's a 5 times more reason to invest in walking and cycling in those countries where we've got people dying, particularly from that air pollution and where we've got physical inactivity. But certainly people like Ireland who've come together and written a fantastic report, and you might have seen announced over the weekend, more than £1 million a day is going to be new money is going to be spent on walking and cycling, with ambitious targets to actually increase walking by 100% and assume a 300% rise in cycling, partly because of COVID, but now how to sustain that. You know, that ambition is the sort of thing we would love to see in many countries. In Africa, the guidance that exists at the moment tends to be talking about wiping down seats, washing people's hands, putting chalk on the ground. It hasn't, as far as we know, but we're about to do a survey starting tomorrow across all 54 countries in Africa to really get an in-depth understanding about just how much action is happening in response to COVID in terms of relationship to public transport, walking and cycling. So we will get a better grip on this and make sure that the support is there and in place. But the question really has to be, how do we enable walking and cycling? in all of these countries. And it's quite clear that there is a formula. There's a formula that we know helps, which is more process orientated. And it's a delight to be talking to planners about that, because I know that is something that you're trained and potentially could help with the delivery of it in more countries and in more places. We've understood that over time, certainly political commitment to the Sustainable Development Goals is a great framework to actually get things started. Investing in a plan makes a lot of sense, but actually supporting the delivery of that plan is just as important. This plan here shows the first non-motorized transport policy, as it was called, that dates back to 2012, the first in Africa that was published in Uganda. But very little actually has happened to it. And I think I don't need to tell planners that writing the plan can't be the end of it. It's actually supporting the delivery and making sure that it's appropriate is what's key. And from that point of view, we know that design guidance is absolutely critical to actually apply local interpretation about what to do that makes it work on the ground. Picking up that thing about footpaths, picking up that point about lack of cycling infrastructure, actually knowing where to start and how to apply it is really critical. And we know from work we've done with Share the Road campaign, the UN Environment Project based in Nairobi, that you need to ask about how programs are being implemented, therefore not just about whether they have a policy in place. Actually mapping this has been really helpful to understand where to put your support, at what point training and guidance is necessary to actually make things happen on the ground. The people that had a plan, and we've seen this around the world, certainly the people I know about most closely in London, they had a plan because they hosted the Olympics. They had a plan because they've dealt with other emergencies in the past. And so rolling something out was a lot easier than people who didn't have a plan at all. But ultimately, this is about making sure that we do have some global indicators that can be used to make sure that we're measuring some success. This example, this picture is from Lagos in Nigeria. And like most countries, there are pockets of success and really wonderful infrastructure where walking, cycling is happening and is being designed and delivered really well. It's the inequality of that and the lack of consistency is what surprises us and challenges us. And I think is the thing that I hope in a partnership with RTPI, we might consider how we might try and improve. It doesn't help when we have traditional or what's become traditional livability rankings that always puts cities in the global south at the bottom and always makes these other cities in the north feel impossible to reach. And yet, the things that we've talked about are things that everybody could do. So I wanted to put to you that isn't it a time, this is what we're thinking at the moment, that because of COVID, this is a time where we could be thinking about a Walkable Cities Award that rewards process as well as outcomes, that thinks about the values and investment throughout the good governance to actually pick up the processes and things that we've just talked about and highlighted to you just now. And I'll leave you with one example of a project that I've been involved with for many years, at least 20 years, but it started back in 1977, and those of you who know London will know how back in 1977, the River Thames, which arguably with that picture now, is probably one of the most walkable parts of any city in the world, certainly one of the most walkable parts of London. But at that time, you could not walk along the River Thames, but it was town planners who got together in the 70s and decided, in response to the Queen's Silver Jubilee, that it was time to dedicate a walkway along the South Bank and to make sure that we could open it and celebrate it as a walkable area. It took 17 years for that full access along the river all the way through London to make it now one of the most walkable places. And because of that, we've been thinking and taking that initiative forwards to actually think about how we could apply that same approach to 100 cities across the Commonwealth and think about all those places where at least we could create a single walkway in all these countries, in the main towns and cities, where everybody would have a chance to walk. And we'd be delighted to work with RTPI and anybody who was interested internationally in thinking about how we could invest in that walkability and actually deliver something, not just plan it, but actually make sure that we hold the hands and make it happen. So thank you very much for your time and for inviting us into this. I hope this is just the beginning of our journey together.
Thank you very much for that, Jim. It was really a fascinating and very rich presentation full of data, and it was really a pleasure to learn so many things about mobility in low-income countries. Since this has been brought up several times during the presentation, I am very pleased to share with you again that we are preparing an international strategy, and this process is being led by members, and our Vice President Wei Yang is co-chairing the group that is doing that. We are more or less at the beginning of the process, so all these suggestions and interesting insights are very much welcome. The few initial things that I can share with you is that definitely the value of membership of the RTPI and the convening power, coordination power of planning is one of the things that the Institute wants to invest on. And so absolutely having a better understanding of what is going on with the other built environment professions and engineering and transport is absolutely vital. So we are very glad to host this session today. And of course, you made a very interesting business case for why investment is necessary in those areas. Another key issue is that we are, of course, committed of making that happen collaboratively, as I said. And this is why we have just supported the Commonwealth built environment professions in issuing the initial findings of a survey of the built environment professions in the Commonwealth countries, which highlights a key massive gap in capacity and identifies low effectiveness of building codes and of planning policy in many countries that need to be addressed urgently if we are to meet the challenges of the SDGs. We are publicizing that. It will be soon on our social media channel and so on. So watch the space and please absolutely engage with the agenda. It's a fascinating thing to be working on. I would now invite people. We are overrunning a little bit, but we are the last session of the day, so we are allowed to do that, apparently. I would invite all the attendees, if they have any questions, to write them now in the log box. There is a drop-down menu saying questions. I think some of the main and most interesting things that have been covered today were probably data, and the ability to gather the data that are reliable and can provide us with a good picture of real-time changes and how we can take stock of that. Possibly the role of planning, of integrated planning, to make sure that investments are far-reaching and they're not just sustainable in terms of cutting emissions, but also socially and economically sustainable. And of course, the linkages between air pollution and road safety and deaths. And we are now seeing that there is an increasing body of evidence and debate in the scientific community regarding the possibility that there might be an actual link between those things and COVID-19 impacts as well. So I guess, just to break the ice, I would like to hear from Bernard if there are any insights that you are able to share with us in terms of what might be some of the initial issues that the program will be addressing in the very near future. Yeah. You have to unmute your microphone again, sir.
Yeah, I have. Thank you very much, Michele. And I thought those were very interesting. I mean, certainly for us at HVT, climate change is highly a priority, and we cut across those with inclusion, being a UK aid-funded program. But we see the need really for, and that's why I'm very pleased that we've had the opportunity to interact with RTPI. We see the need for a much more collective way of working to address some of those issues in the global south. We think that's the trick to getting some traction to some of the intractable issues. I also think really in terms of getting action on the ground, there is a lot of recognition of the problems that face the global south in terms of planning, in terms of transportation. I think there comes a stage when one has to say, well, we have to start talking now and start acting. And that is the message I like to sort of convey. And very interesting statistics. And we see some of the successes that are actually on the ground. And I think the changes in terms of how we visualize transport in the future brought about by the COVID-19 pandemic, offers us an opportunity to grab certain grab the opportunities that are presented for change. Many people in the global south, the cities, the transport organizations, the planners are clamoring for change. We have city executives asking, we know what we have, it's not fit for purpose, but we don't know where to go for the information. So we're also concentrating on getting the information out there so that people can have access to the information. To many of the changes that we see in the global north are simply not happening in the south because, one, they're not aware of it, and the evidence base for them to actually execute some of those changes are not there. Thank you.
Thank you very much for that, Bernard. I don't think we have questions from our audience. So on that note of collaborative thinking and joint efforts, I think we can close this session. Thank you very much for being here today, and we look forward to continuing these conversations in other forms. Thank you.
Thanks so much.